Okay. Good evening, everyone. My name is Ajala O'Berry, and today I'm going to be showing you my dilation and curettage makeup table. As you can see, I'm missing some instruments, so I filled things in with the cards. I'm going to go over each and every individual item on this table, step by step, and how things are used. So, a little bit about the history of a dilation and curettage set is that dilation and curettage is pretty much used to remove any particles that have been left for a possible miscarriage or an ectopic pregnancy, and a woman is experiencing any kind of bleeding or excessive clots coming out. Usually, they will undergo a procedure to have the rest of the debris removed. Okay, so this is my sterile basin, and you have the sterile towels on top and the drape underneath. I wasn't able to find everything I needed in my kit, so I improvised a little bit. Um, these are the lap sponges or the Raytex sponges, the pretend ones. This is the iodine soak, or the betadine soak that I found. And then I put a little cup right here. The instruments inside of the pan that we would need for this specific procedures. And then up top, I also have the povidone iodine scrub. I believe this is used to pretty much prep the patient, suture, and the instruments that aren't with us. The water bottle serves as my saline on the back table. So the patient comes in for this procedure. They're placed in a lithotomy position with their legs in candy canes or yellow fins. I don't believe they use a lot of candy canes stirrups anymore, so it might be something different. Um, so, how it begins is the Alvard speculum is placed into the vagina, and the two tenaculum, which is one of the cards I could not find in my stack. The two tenaculum is used to pretty much grasp the cervix. After the cervix is grasped, the uterine sound, which is another card I did not have, will be used to determine the depth and angle of the cavity. The cervix is dilated with the surgeon's choice of dilators. So we have your Pratts, we have your Hagars, and we have your Hank. One tip I do want to say is that all of these usually Pratts and Hagars are usually a set of 8. Hank is usually a set of 7. Normally in a dilation and curettage set, it's a set of 7 or a set of 8. It's the Pratts that are usually within that set. So they will use one of the dilators in order to determine they will dilate the cervix so that way they can see how deep they need to go in and get it to open up. So after they do that, the cervix will be dilated. A curette of the doctor's choice will be used to scrape away the walls of the uterus. So these are the curettes right here. They come in different sizes. They also have something called a Kevorkian. And unfortunately, those are again tools I didn't have. I had 2 extra spots to be able to put those tools down. I know in some dilation and curettage sets, they also have vaginal speculums. The speculum that typically goes in that set is either a Peterson or Graves. Unfortunately, I was only able to find a smaller speculum and an open-sided vag spec. Sometimes they may use the open-sided vag spec during the procedure. So the drape would it would begin with the drape going under the buttocks, the legs, and we would use a lap drape. Most of the time, the surgical technician would work off the back table instead of using the Mayo table. The sponge stick should always be ready to pass to the doctors. So the sponge sticks meaning the forceps. A catheter is placed at the beginning of the surgery to avoid injury to the bladder. The dilator should be passed to the doctor in the numbered order with lubrication on each one. Tough should be ready for any specimens of endometrial curettings. So pretty much that's it so far. I believe I'll go through this pan of things with you. Again, everything is not in here. I kind of went off the memory of what I do as a sterile processing technician. So this I know is one thing that isn't in the set, but this is called a yank hour. And I know on the back table, they typically call for a yank hour for suctioning. And then you have your hand retaining retractors. You have your pickups, which is what they're called in the OR. So you have your pickups without teeth. You have your pickups with teeth. And then you have your sutures. Now, this may not be the right suture for this procedure if there's a suture that is needed at all. But I did want to put a suture. Sometimes they may use a this to be able to get the site ready. The saline is always used to irrigate the wound. Let's see. Okay, so I think that's pretty much it as far as the explanation of the back table setup that I could come up with. So hopefully this was something that looked correct. I did the best that I could with what I had. And if there's any questions or concerns, as I continue to move along further in school, I will learn more how to properly set my back table. This was a first of many, but I'm pretty proud of how the setup came out, rendering that all the instruments are not available, and I kind of improvise with a lot of things. So probably should turn these over so we're aware of what these are. And there is a dilation and curettage back table setup. Thank you.